My name is Myra Wiley, and I'm the Program Director for Hands to Hearts Academy. Today, we will be demonstrating range of motion for the wrist for the State Registered Nurse Aide program in Kentucky. With all of our skills, you have opening steps that you have to perform before you start your skill. First, we need to knock on the door, identify ourselves, greet the resident, explain the procedure, gather our supplies, and provide privacy. Once we've done those things, then we want to provide safety for the resident by raising the bed rail, coming to the other side of the bed, raising the bed rail, and then raising the bed for good body mechanics. Because I have a crank bed, you will not see me raising or lowering my bed, but I will verbalize at the appropriate times during the skill when you should. Because I'll be working from this side of the bed, I will lower this bed rail. Perform hand hygiene, and we'll only expose the part of the body we're going to work with. So today we're working with the wrist. We're going to support the wrist. First, we're going to do flexion, extension, hyperextension. I'll say that again. Flexion, extension, hyperextension. We will repeat these movements 5 times. We'll be sure not to move the joint, pass free movement, and we'll be sure to ask the resident, are they having any pain or discomfort? Next set of movements for the wrist are radial and ulnar. Radial, if you think about your vital signs when you're feeling for the radial pulse, that's going to be moving the hand towards the thumb. So radial, moving it back is towards the pinky, ulnar. Depending on the mannequin you have, you may not be able to do it very well, so you may have to demonstrate on yourself. So again, that's radial, moving the wrist towards the thumb, ulnar, moving the wrist towards the pinky. Again, we're doing that 5 times. We're not moving the joint past free movement, and we're asking the resident if they have any pain or discomfort. When we are done with our range of motion, we want to make sure that we give our resident their call light and that it's within reach. We want to lower our bed for safety. We want to go around to the other side of the bed and lower that bed rail as well. We want to ask the resident if they need anything else from us. We want to make sure that they're comfortable. We want to provide hand hygiene to ourselves. And we want to report and record.